So yes, good evening, everyone. Mukesh, Sudhanshu, hello, Aisha, hello. So before starting with the session, guys, just give me a thumbs up in the chat box if the audio and visuals are perfectly fine. If the audio and visuals are perfectly fine, please give me a thumbs up in the chat box. Right, Akhilesh, good evening, good evening. Yes. Today, like we are going to focus on the important aspects. Namaste, I'm Mukesh. Yes, Mukesh, hello. Aisha, perfect. Shivam Kumar, good evening, beta. Good evening, beta. Yes, good evening. Chalo. Let's start with the session, guys. Today I will be discussing the important aspects of the skull, that is the Norma Lateralis and the Norma Basalis Externa. Yes. Jeev Hit, namaste, beta. Let us start with the yes. The Norma Lateralis, guys. Along with me, please write the notes along with me. Right? Yes. Physiotherapist, good evening, beta. Yeah, good evening. Sure. Let's give me a thumbs up, guys, that you all are ready with your notebooks. You are all having your pens in your hand. You are ready to write the notes along with me. You are ready to understand the topic with me. So just give me a thumbs up in the chat box. Yes, Shivam, I'm diploma. Yes. Great. Kelvin, okay, perfect. Chaliye. Akhilesh, perfect. Perfect, guys. Chalo. Neelam, I've already started. Beta, I will be completing the Norma Lateralis and the Norma Basalis Externa in all the aspects, guys. Right? Ear ossicles are included. I mean, just a part of the middle ear. Yeah. I will be discussing ear separately. Not included, actually. Yeah. BPT. Neelam, very good. Very good, beta. Yes, Shivam Kumar, perfect. Sure. Let us start with this particular. Yeah. The Norma Lateralis, basically what view it is, guys. You already know this is the lateral or the side view. This is the lateral view or the side view. Now, guys, in this, guys, Sudhanshu, hello. Now, you guys are going to tell me which all bones you can see. Can you please tell me the name of this bone, guys? Which is this bone that I have marked over here? Okay. So the very first thing that we are going to discuss, it is the bones forming it. Chalo. The bones which are forming it. Very good, Aisha, Sudhanshu, Ankita, very good. Osama, very good. Abdul Ali Mohammed, very good. Good evening, beta. This is the parietal bone, guys. This is the parietal bone. Now, guys, just try to see over here. Below the parietal bone, guys, we have the temporal bone. Yes, Shivam, Mukesh, Akhilesh, Sabi, Kunar, Soni, very good. The temporal bone. This bone, guys, it is the frontal bone. Yes, you can see the frontal bone over here. And behind, guys, you guys are going to tell me it is which bone. Chalo, फटाफट से बता दो, this is which bone, guys. The major bones you already know. But in the lateral view, guys, you can also appreciate this zygomatic bone. You can also appreciate the zygomatic bone. Even this yellow colored bone, beta, which you can appreciate over here. Yes, Sudhanshu, Aisha, Ankita, Akhilesh, Mukesh, Osama, Neelam, Imran, very good, beta. And especially, guys, if I just want to write this, this is the squamous part of temporal bone. Remember, beta, it is the squamous part of temporal bone. Yes. Shebas Shivam, very good. It is the squamous part of temporal bone. It is the squamous part of temporal bone. This yellow colored bone, beta. This is which bone that we have already discussed, guys? Yes. It is the sphenoid bone. It is the sphenoid bone. And more precisely, beta, it is the greater wings of the sphenoid. If you want to know, guys, we have already discussed the sphenoid bone in the last lecture also. I've shown you a picture. If you just remember this, guys. If you just remember this, this is the sphenoid bone, and this is okay. Let me just. If you can just appreciate, guys, this yellow colored part, it is the greater wing of the sphenoid bone. Greater wing. So whatever you can see over here beta in the lateral view, it is the greater wing of the sphenoid bone, right? It is the greater wing of the sphenoid bone. Abdi Kadir, very good. Yes, Shebas, very good. So yes, it is the greater wing of the sphenoid bone. I hope you can also appreciate this yellow colored bone. On the lateral part, it is only the greater wing which is visible. This is the sphenoid bone. And I have told you guys that sphenoid bone, it is only one. It is only one. And this is the like the greater wing of the sphenoid bone, right? On both the sides, right? So automatically don't think it is two in number, it is one only. So the greater wings are projecting on both the sides, right? So let us just try to write all the points that we have like discussed as of now. So yes, the bones forming it. Yes, you already know we have the parietal bone, the temporal bone, the temporal bone. Yes. Mangal, good evening, beta. Yes. The third one, guys, remember we have the greater wing of sphenoid. ये sphenoid है बेटा येलो वाली. This is the sphenoid और sphenoid का कौन सा part है? This is the greater wing. It is the greater wing of sphenoid. I will be discussing each bone separately. No need to worry. But as of now, I'm just discussing the different aspects. Yes. We also have the squamous part of the occipital bone. I have like mistakenly written temporal. It is occipital beta. It is occipital. Yeah. Hmm. It is the occipital bone. Chal. We have the squamous part of occipital bone. Squamous part of occipital bone. Okay. We have the zygomatic bone. We have the zygomatic bone. Okay, guys. Can you appreciate in the lateral view which bone is this, guys? Anyone in the chat box would like to tell me which bone is this? Chalo, I'm waiting for your answers, guys. Yeah. The sixth one you tell me, and the seventh one I will tell you. That is the mandible. That is the mandible. Yes, it is the maxilla. Very good, Sudhanshu, Osama, Neelam. Very good. If you are able to appreciate, guys, it is very good. So we have the maxilla bone and we have the mandible bone also. The mandible bone also. So these are the bones appreciating, like we can appreciate over here. Okay, guys. We can also appreciate the nasal bones. I hope you can very well see the nasal bones, guys. Right? Good evening. Yes, good evening, beta. Yes, you must get more deserved than our college teacher because they were just time. It's okay. Please, every faculty is like same. Yeah. So we have the nasal bones, beta. Nasal bones, right? Behind the nasal, this is the maxilla bone only, right? This is the maxilla bone. And can anyone tell me which bone is this, guys? Chalo. Behind the nasal bone, which bone? Okay, behind the nasal, we have the part of the maxilla bone only, maxilla only. Behind the maxilla, what is there? चलो फटाफट से बताओ नहीं अब्दी कादिर नहीं बेटा it is the lacrimal bone yes it is the lacrimal bone बेटा ये lacrimal bone है ये lacrimal bone है lacrimal bone के पीछे we have the ethmoid ये जो green वाली दिख रही है ना छोटी वाली this is the ethmoid और I can simply say the orbital plate of ethmoid bone क्योंकि ये ऑर्बिट बना रही है आगे की तरफ ऑर्बिट होता है यस Shenaz, Sudhanshu, Mihir, Mahachan, very good, beta. So we have like more bones you can write. We have the lacrimal bone beta also in the lateral view, and a small portion of this ethmoid bone also you can see over here, right? But as of now it's not measured, so we'll write all this. Sure. इतना clear है सब लोगों को? I hope this is clear, everyone. Just give me a thumbs up in the chat box. Yes. चलो फटाफट से एक thumbs up दे दो if the bones are done. Bones are done. चलो. Norma Lateralis, the bones are done. Mihir, very good. Very good. Mukesh, Osama, very good. Very good. Yes, I am teaching all the entire anatomy, but I've already completed the neuroanatomy. I'm going to discuss head and neck will take time, obviously. Neelam, Abdi Kadir, very good. Very good, beta. Now, Coming on to the next part, guys, the special features. Special features of Norma Lateralis. Yes, the special features of Norma Lateralis. I don't know why does it comes. Norma Lateralis. Now we are going to discuss some important features, guys. Now, let us again take this view over here. Yeah, I do have another picture for it. No, okay. Now, guys, mhm, just a moment. Let me at least. Okay. Just 1 minute, guys. Now, you guys are going to tell me. I am like first. I will be talking about the superior temporal line. Now, you guys already know that this bone, it is the zygomatic bone, right? And this is the temporal bone, right? This is the temporal bone. That is something you guys already know from the previous part. Now, guys, you can very well appreciate that this part over here, okay, this is which process of the zygomatic bone. Yesterday I have told you guys that process means any part of the bone which is like going away from the body. We have our own body and our upper limb is going away. That's why the bone has a body which has the maximum area and some part of the bone it is going above. You guys are going to tell me, yes, which process is this? You guys already know this is the frontal bone, guys. This is the frontal bone. And remember, guys, this will be called as, yes, the frontal process of zygomatic bone. It will be called as the frontal process of zygomatic bone. Zygomatic bone. And if you know this, guys, you guys are going to tell me this is which process of zygomatic bone now. This is which process of zygomatic bone. Yes, Ishita, Mihir, Ankita, very good. Shebas, Momin, Abdikar, very good, very good. Now, guys, listen over here. The special features is firstly is the temporal lines, guys. Okay, we have the superior temporal lines, guys, right? Yes, please just try to focus over here. Yes, the temporal process of the zygomatic bone. Mihir, very good, Pita. Zygomatic bone ka part it is going towards the temporal bone, this cream colored bone, right? Yes, Ishita, very good, Pita, very good. Now, guys, you already know we have a line that is now extending from, yes, it is like going from this zygomatic process of the temporal bone. Not exactly, yeah, it's starting from this, the frontal part, guys. It is going above like this, okay? As it goes behind, like as it crosses the coronal suture, guys. Let us just try to understand this. We have a line that is called as the superior temporal line, right? We have a line that is called as the superior uh, temporal line, okay? Now, see, this line, it is basically a temporal line which divides into, like, as soon as it crosses this suture, you already know this is the coronal suture. It is the coronal suture present between the frontal and the parietal bones. Now, this temporal line, it starts from the frontal process of the zygomatic bone. I mean, and then it is basically crossing the coronal suture and it will be dividing into superior and inferior temporal line. Superior temporal line will go back in the parietal bone and it will fade away. It will go back in the parietal bone and it will fade away. गायब हो जाएगा. Inferior temporal line will continue downwards and it will come to, yes, it will come down to become continuous with Yes, it will come down to become continuous with the supramastoid crest. Right? This is okay. Let me label this part of the temporal bone. This is the mastoid part, right? And mastoid part के ऊपर, I have already told you what is crest, guys. What is crest? You already know that crest is basically thickened border. This is a line, and if this line becomes a little thick, it is called border. And if this is very, very thick, it becomes crest. So we have a part above the mastoid, and that is called as the supra. Supra means above the mastoid, supramastoid crest. Supramastoid crest. So this line, guys, this line, it is called as the inferior temporal line. Okay, inferior temporal line. And this temporal line will be merging with the supramastoid crest, right? Supramastoid crest, right? So that is something you have to remember. Okay. So we have in the special features of the Norma Lateralis. I hope this is clear, guys. Just give me a thumbs up in the chat box if this is clear. फटाफट से एक thumbs up दे दो अगर clear है तो. चलो. We have the temporal lines, the supratemporal line, the infratemporal line. Supratemporal line, like after the temporal line after crossing the coronal suture divides into supratemporal, infratemporal. Infratemporal will curve downwards and will fuse with the supramastoid crest. Yes, yes. Now, so okay, you already know we have supratemporal line. No need to write like much stories about it. Supratemporal line. We have the infratemporal line. Infratemporal line. And remember that infratemporal line, beta, all over it is giving attachment to one muscle. Okay, it is giving origin to, very, very important. And you already know we have a muscle coming out from here, from the infratemporal line, from all this part, guys. Yes, and this muscle, it is called as the temporalis muscle. Abdika, Rishita, Mihir, Prajwal, Shebaz, Momin, yes. It is called as the temporalis muscle. Temporalis muscle. Right? It is called as the temporalis muscle. So it is coming from the inferior temporal line. It is giving origin to the temporalis muscle. Right? Now, supramastoid crest, guys, you already know it is the lower end of the temporal line. Which line? Inferior temporal line. As it tries to go towards the mastoid process, right? And this supramastoid crest, basically, this is the zygomatic arch only, right? हाँ ठीक है बिल्कुल ठीक है सब लोग ठीक बोल रहे हैं right. So that is something you have to remember over here, right? So this is the supramastoid crest if you just want to label it. The supramastoid crest, right? Now let us discuss one very important part over here that is called as, yes, this is called as the zygomatic arch, right? It is called as the zygomatic arch, right? Now this arch, guys, this arch which you can see, that is called as the zygomatic arch. Now zygomatic arch, guys, it is a bony bridge. Let me please write about in the special features the third one, that is the zygomatic arch. Now the zygomatic arch, guys, it is a bony bridge. Bony bridge. And you already know the parts, guys. Let me just erase it, and you guys are going to tell me the different parts. Now anteriorly, guys, anteriorly, which part is this, guys? You guys are going to tell me. Which part is this anteriorly? Okay. Posteriorly, you are going to tell me which part is this. देखो anterior यही होगा and posterior will be this, right? So posteriorly it will be which part? चलो सुधांशु पांडे, yeah, good evening beta. Now, this will be having, yeah, the anterior part. Anteriorly, it is formed of, yes, the zygomatic process of, very good, Abdikar. Very good. It is the zygo, it is the, yes, temporal process of the zygomatic bone. Very good. Very good. Zygomatic. Yes. Specifically, it is the temporal process, guys. Shebas, Mihir, Sudhanshu, Abdikar, Ramu, Ishita, Mihir, Shebas. Very good. Very good. It is the temporal process of zygomatic bone, right? Posteriorly, बेटा अगर पीछे की तरफ देखोगे कि कौन सा प्रोसेस है, you guys are going to tell me which process of temporal bone is this. It is going towards which bone? Zygomatic. So what will be the name of this process, guys? What will be the name of this process, guys? Yes, this is the part of the temporal bone. It is the process of the temporal bone going towards which bone? Zygomatic bone. So what will be the name, guys? Yes, posteriorly it is the zygomatic process of temporal bone. Zygomatic process of temporal bone. Right. Very good. Very good. Everyone is right. Yes. Ishita, Abdikar, Neelam. Very good. Now, guys, over here, I wanted to discuss something very, very important over here. Now, guys, just try to see. You already know we have the, yes, the temporal process of the zygomatic bone. We have the zygomatic process of the temporal bone. But specifically, when I'm talking about the lower border, guys, the lower border over here, the lower border and the inner surface. Now, guys, remember फिजियोथेरेपिस्ट लोअर बॉर्डर, नीचे वाला बॉर्डर, और देखो दो सरफेस होंगे, एक आगे की तरफ से होगा और एक पीछे वाला सरफेस होगा. एक आउटर सरफेस जो बाहर देख रहे हो जहां पे एरिया ज्यादा होता है बेटा, उसको आउटर सरफेस बोलते हैं. मतलब आप सरफेस बोलते हैं, ऑब्वियसली द सरफेस इज आउटसाइड, इट विल बी द आउटर सरफेस. और एक अंदर की तरफ एक सरफेस होगा आर्च, ठीक है, इनर सरफेस होगा. ध्यान रखना इसका जो लोअर बॉर्डर है और इनर सरफेस है जाइगोमैटिक आर्च का, द लोअर बॉर्डर plus inner surface, it gives origin to one of the muscle, guys, and that is very, very important. That is called as the masseter muscle. That is called as the masseter muscle origin. It is called as the masseter muscle origin. Okay. Now I hope you can really appreciate, guys. When I say zygomatic arch is this, right? This is formed of a part of the zygomatic bone, right? That is the temporal process of the zygomatic bone and zygomatic process of the temporal bone, right? And below this, yes, below this, guys, we have, yeah, the lower border, okay? And we have a surface inside. The one which you can see, it is the outer surface, and one behind it will be the inner surface. They both will give rise to one of the muscle that is called as the masseter muscle, right? I hope this is clear, everyone. Just give me a thumbs up, guys, if it is clear. चल फटाफट से एक थम्स अप दे दो. चलो नीलम, very good guys. Shebaz, very good. So we have just discussed the bones forming it. Okay, I have not mentioned the sutures, guys, but you already know the sutures. Sutures will be your homework part. You already know this suture. What is this suture? What is this suture? What is this suture? All the names of the sutures we have already discussed it. Yes, बेटा हिंदी में भी बोल रहा हूँ. हाँ, don't worry, I will speak in Hindi as well. कोई दिक्कत नहीं है. किसको लगे कि हिंदी में बोलना है तो प्लीज बता देना. Now, guys, we are going to start with Aditya Singh. Very good. We are going to start with the parts of the temporal bone. Parts of temporal bone. Now, guys, the parts of the temporal bone, we have the supratemporal area, right? We have the temporal fossa, the infratemporal fossa, right? And we have a region that is called as the stylomastoid region. I will be like discussing it one by one. the parts of, okay, not exactly the temporal bone, guys. Obviously, it is the norma lateralis. So yeah, anyways, the temporal bone will be a part of this norma lateralis also. Now, but everything is like connected to this particular bone only, right? Now, when we talk about the supratemporal area, again makes a sense, guys. Temporal bone के ऊपर वाले area की बात कर रहे हैं. Okay, it is basically talking about the area which is like above the temporal bone, right? Above the temporal bone and like okay. Now you can see the inferior temporal line, right? And you can see the temporal boundary over here. So this is called as the supratemporal fossa. Now, supratemporal fossa, it is above the temporal bone, okay, and it is like below this inferior temporal line or below the temporal line. ये जो area है guys, इसको हम supratemporal fossa बोलते हैं. It is called as the supratemporal fossa, right? So let us just try to write it. Yeah, the supratemporal area, it is between the, yeah, okay, it is between. So you can just mention it, guys. It is above temporal bone and below, yes, the temporal line, especially the inferior temporal line, right? Now we have something called as the temporal fossa, guys. Now if we talk about the temporal fossa, you already know we have the superior temporal line above, right? The zygomatic arch below, okay? And yes, now guys, if you can see very well, this is called as the zygomatic arch, right? So it is the like the temporal fossa, we have the zygomatic arch, it is below. Above, you already know we have the superior temporal lines are there, right? The superior temporal lines are there, right? And we have the anteriorly, guys, you already know we have the frontal process of the, yes, we have the frontal process of the zygomatic bone. I'm just focusing on this area, guys, over here. Yes, this area, that is yes, which you can see over here. So that is something called as the temporal fossa, right? Anteriorly, आगे की तरफ देखो बेटा, आगे की तरफ क्या प्रेजेंट है? फ्रंटल प्रोसेस ऑफ द जाइगोमैटिक बोन, ये आगे की तरफ प्रेजेंट है, राइट? ठीक है, नीचे की तरफ क्या प्रेजेंट है? जाइगोमैटिक आर्च, ठीक है, और ऊपर क्या? ऊपर तो ये टेम्पोरल लाइन प्रेजेंट है, राइट? द टेम्पोरल लाइन विच इज लाइक एक्सटेंडिंग, राइट? सो yes, just you have to mention this ki temporal fossa, the boundaries are like over here only. Yes, we have superior temporal line, like it is above and behind. We have the zygomatic arch below, and we have the frontal process of zygomatic arch anteriorly. Right? Now, guys, over here, the two important things that you have to like understand in this temporal fossa, the floor of this fossa, the lower part of this fossa, yes, the floor, basically we again have a muscle over here, yes, that is called as temporalis muscle. So temporalis, it is coming from everywhere, guys. It is coming from everywhere. So remember, the temporalis muscle will be like over here also. And we have one more muscle, guys, we have already talked about, that is the masseter muscle. It basically arises from the lower border and the inner surface of the zygomatic arch. इसके lower border से आती है और इसका जो अंदर वाला surface है, ये तो बाहर वाला दिख रहा है, इसके अंदर वाला जो surface है, that will be the inner surface of the zygomatic arch, right? So that is something you have to remember about the temporal fossa also, right? Now coming on to the infratemporal fossa. Yes, I will be teaching all the muscles. I will be teaching all the muscles. No need to worry. But as of now, since we are discussing like in an aspect, guys, so just try to focus on that as well. चलो इतना क्लियर है सब लोगों को फटाफट से एक थम्स अप दे दो इफ दिस इज क्लियर टू एवरीवन फटाफट से एक थम्स अप दे दो इफ इट इज क्लियर टू एवरीवन चलो फिजियोथेरेपिस्ट वेरी गुड अब्दी कादिर ओके शहबाज मोमीन वेरी गुड वेरी गुड वेरी गुड बेटा चलो फटाफट से थोड़ा इसको फटाफट से देखते हैं इंफ्रा टेम्पोरल फोसा नाउ गाइस we are going to talk about the infratemporal fossa again, very important. Yes, Shebaz, Firoz, Ishita, Akhilesh, very good. Infratemporal fossa. I will be discussing each bone, each muscle separately. No need to worry. I'm like taking detailed lectures. So yes, as of now, just try to mention some important points over here. We anyways are going to discuss it again. Now space. Now infratemporal means beta temporal के नीचे वाला जो space होगा. So it is the space below temporal fossa. It is space below temporal fossa. Okay, and basically beta I'm talking about this space. It is like below the temporal fossa, right? And it is like behind which bone, guys? It is the maxilla. If you can very clearly see, guys, I am gonna talk about this space now, guys. This highlighted space, it is behind the maxilla, guys, and it is below the temporal fossa, right? ये maxilla bone है. This is the maxilla. Maxilla के पीछे और temporal bone के नीचे वाला जो space है, that is called as the infratemporal fossa, right? It is called as the infratemporal fossa. It is space below temporal fossa. Yes, and behind maxilla. Behind maxilla. Now, guys, again, you guys are going to tell me the boundaries. This is like very important. Boundaries. Now, chalo. Now, guys, tell me very commonly if this is the space from anterior to posterior, right? From anterior to posterior. Okay. Which bone will be in on the anterior side? चलो फटाफट से बताओ which bone will be on the anterior side? आगे कौन सी बोन होगी? अगर ये स्पेस है तो आगे कौन सी? मैंडिबल को रिमूव कर दो, आगे कौन सी बोन होगी गाइस? मैंडिबल रिमूव कर दिया बेटा, मैंडिबल को हटा के हम लोग स्पेस देख रहे हैं, राइट? बेटा नहीं, जाइगोमैटिक तो ऊपर चली गई ना, मैं तो मैक्सिला के पीछे वाली स्पेस की बात कर रहा था, तो ऑब्वियसली बेटा ये मैक्सिला ही तो होगी, मैक्सिला ही तो होगी ये, राइट? इट विल बी मैक्सिला ओनली. फिरोज बेटा मैक्सिला होगी, मैंडिबल को रिमूव करना है यहाँ पे, वी हैव टू लाइक रिमूव द मैंडिबल एंड देन वी हैव टू सी. यस. If you want, let me just insert one picture. Yes. Yes, guys, I'm like talking about this particular part. Sure. I hope the image is visible now, guys. I hope the image is visible. Now, guys, this area which I'm highlighting over here, this area, it is the infratemporal part, infratemporal fossa. अब खुद बता दो बेटा कि आगे कौन सी बोन है? This is the maxilla. Anterior ये है, posterior ये होगा. Now, which, okay, you guys are going to tell me which surface of the maxilla will be there. Ankita, very good, very good. Which surface of the maxilla will be there? Anterior surface or posterior surface? So guys, you already know Yes. Anteriorly, we have the posterior surface of maxilla. Maxilla का आगे वाला surface ये हो गया, ये पीछे वाला surface ही होगा ना. Infratemporal fossa का आगे वाला surface, yes, it is the posterior. Aditya, very good. Venkatesh, very good. Very good, beta. So we have the posterior surface of maxilla. Infratemporal surface का आगे वाला हिस्सा कौन सी बोन बना रही है? मैक्सिला. और मैक्सिला का कौन सा सरफेस है बेटा? इट्स द पोस्टीरियर सरफेस. यस फिरोजरी, वेरी गुड वेरी गुड. जस्ट ट्राई टू इमेजिन गाइस, जस्ट लुक एंड इमेजिन. मीडियली गाइस, ओके, मीडियली बेटा हम लोग का एक प्लेट देखने को मिलता है, दैट इज कॉल्ड एज द lateral pterygoid plate. I will be like focusing on it soon. Yes, yes, we have the lateral pterygoid plate, and yes, we have like below this, yes, medially we have the lateral, yes, the lateral pterygoid plate. I will be showing you the pterygoid plate also, no need to worry, right? Okay, posteriorly guys, posteriorly, you already know we have a process that is coming out, a bony projection coming out. It is called as the styloid process. Styloid process. And guys, we have this, yes, this is the mastoid part, the mastoid process. The mastoid process, guys, the mastoid process and the styloid process. Styloid, they are all parts of the temporal bone, the styloid process and the mastoid process, right? So yes, or laterally. Lateral beta इसमें दिखेगा नहीं because it's just the outer part. Laterally, it is the coronoid process of mandible. We have the mandible over here, and in the mandible we have like two processes, guys, two processes which will be on the outer side, and that is the, yes, the coronoid process of the mandible. We already know, yes, if suppose this is the mandible, guys, you have like these two, yes, the ramus, the arms of the mandible, and we have like two processes, guys. These are called as condylar, or like the coronoid process, guys, the coronoid process. Two projections coming from the ramus of the mandible, and these are called as the coronoid process of the, yes, yes, the temporomandibular joint. Very good, guys. Right? I hope the boundaries are clear, guys. I hope the boundaries are clear. Just give me a thumbs up, guys, in the chat box if the boundaries are done. फटाफट से एक thumbs up दे दो if the boundaries are done. Now, guys, coming on to the contents of the infratemporal fossa, very important. Contents of infratemporal fossa. Now, beta, firstly, you have to remember the two muscles. You will see the two muscles, okay? The lateral and the medial pterygoid muscle. Muscles of mastication, guys, the lateral and the medial pterygoid muscles. Yes, Firoz Ali, very good. Venkatesh, very good. Others, I think, are alive. Just please let me know if you guys are alive. Apart from that, guys, you will be able to see in this particular fossa about the ligament, and that is called as the spinomandibular ligament. Spinomandibular ligament. Yes, Venkatesh, very good. Mandibular ligament. Yes. Again, guys, we have the artery over here. Okay, or I can simply write the heading as vessels. I will be including all the arteries and veins which are passing through this infratemporal fossa. And remember, guys, yes, we have the first and second part. first and second part of maxillary artery, and branches. I'll be discussing maxillary artery in detail. We have, yes, pterygoid venous plexus, the pterygoid venous plexus. Plexus means network of veins over here. Yes, and we also have the maxillary vein, right? And the fourth one, guys, the nerves. Nerves are like very, very important. We have the, yes, the mandibular nerve, guys, be very clear. It is the mandibular nerve and its branches. A very small part of maxillary nerve, but it's like a very, very small part. We have chorda tympani. Yes, part of the facial nerve, guys. I will be discussing it. We have something called as otic ganglion, right? So these are something which are like found in the infratemporal fossa. These are something which are like found in the infratemporal fossa. As of now, just remember all this. Yes. Now, facial nerve, trigeminal branch, very good. Very good. That is the chorda tympani, guys. The chorda tympani. So, yes. चलो इतना लिख लिया सब लोगों ने इतना लिख लिया Now in this case, guys, we are going to discuss some important landmarks. Okay, we are going to discuss some important landmarks, guys, right? Hmm. Yes. Now, guys, there is something very important, that is the important landmarks. Now, the very first one, guys, the very first one that we are going to discuss over here, and it is like very, very important. This H-shaped, this H-shaped part, this H-shaped part, this is called as the pterion, right? This is called as, okay, let me write it over here. The pterion. It has been asked in NCI a lot number of times. This is called as the pterion. Now, guys, you are going to tell me it's from anterior to like posterior, right? Now, you guys are going to tell me how many bones are participating to form this area, okay? That is the pterion. How many bones are like uniting to form this particular structure? चलो फटाफट से basically बताओ मुझे. If the very first one I have to write, it is the pterion. 4. Ankita, Osama, Ishita, very good. Very good. Yes. Can anyone tell me the name of the 4 bones? Yes, it is area of meeting of 4 bones. Area of meeting of 4 bones, right? And that is connected by a H-shaped suture. Connected by H-shaped suture. Yes, everyone is right. Venkatesh, Shebas. Yes, Ishita is writing frontal temporal. Okay, what about rest? H-shaped suture, this area. Right? We are like focusing on this area right now. Yes. Which is connected by this H-shaped suture. this area, right? Now, frontal, parietal, temporal, sphenoid. Ankita, very good बेटा. You are like super. चल फटाफट से इसको देख लेते कि यहाँ पे तो फ्रंटल हो गई, ऊपर पेराइटल, ये हो गई हमारी टेम्पोरल, यस, एंड बिलो कौन सा विंग है स्पिनॉइड का? अगेन गाइस, अंकिता प्लीज टेल मी विच विंग ऑफ स्पिनॉइड इज दिस? विच विंग ऑफ स्पिनॉइड इज दिस? यस, connected by four bones. You already know we have, yes, the greater wing. Ankita, Abdikar, Osama, Abukar, very good, very good. It is the greater wing of the sphenoid. And guys, remember we have the frontal bone, the frontal bone. Then we have, yes, the parietal, the temporal, and we have greater wing of sphenoid. Greater wing of sphenoid. Right? These are the bones which are forming this area, right? Now, guys, in, yes, Abukar, very good. Now, at birth, guys, this particular area, which I'm just marking it as terion, it is basically occupied by a membrane, right? And that membrane, it is called as, guys, very, very important. And that membrane, it is called as the sphenoidal fontanelle. Sphenoidal fontanelle. Fontanelle. We have discussed a fontanelle below the bregma and below the yeah, the lambda. Can anyone tell me the name of that fontanelle? And sphenoidal fontanelle will be like both sides, right side also, left side also. These are also called as anterolateral fontanelle. Whenever you see a newborn child, guys, like a newborn is always having these two anterolateral phenomena. They're present anteriorly and on the lateral side. Yes, yes, they are present on the anterior and on the lateral side, guys, right? So basically, it ossifies at the age of 3 months, guys. Initially, whenever a newborn is there, right, they will be having these membrane, and these membrane, like below the arterion, it is called as the sphenoidal fontanelle, anterolateral fontanelle, and it ossifies. It ossifies at age of 3 months. 3 months, right? It ossifies at age of 3 months. It ossifies at age of 3 months. चलो इतना क्लियर है सब लोगों को? इतना क्लियर है? Ossifies at age of 3 months. Later on, it is called as terion, which is formed by these four bones. Yes. Now, yes, guys. Now, why this is important? See, clinically, why this area is very, very important, guys. Remember that this area, the center of the terion, yes, it is basically related internally. Behind this, guys, you will find an artery. Behind this area, an artery is present, and that is called as the anterior branch of middle meningeal artery. Anterior branch of middle meningeal artery. Anterior branch of the middle meningeal artery. Very, very, very important. Anterior branch of the middle meningeal artery. Chalo. I hope the terion is clear to everyone. Just give me a thumbs up in the chat box, guys, if this is clear to each one of you. फटाफट से एक thumbs up दे दो जल्दी से chat box में if this is clear to each one of you. जल्दी से. हाँ, सब इरेक्नॉइड हेमरेज, ठीक है. शिवनाज, ओसामा, वेंकटेश, वेरी गुड. Now, guys, there is another point over here. That is a meeting point of three bones. Yes, guys. Just try to look it over here. Let me use the black pen again. It is the meeting point of like three bones over here. Yes, this point, guys, this point, it is called as asterion. This point, it is called as asterion. Now you guys are going to tell me which bones are like participating to form this particular area. Yes, the next important landmark that you have to study over here. चलो फटाफट से बताओ जल्दी से in the chat box. Asterion, you already know this is the parietal bone, this is the occipital bone, and this is the temporal bone, right? All these three bones. Yes, Abdi Kadir, very good, very good. So next point that we are going to discuss over here, it is asterion. Asterion, and remember guys, it is the meeting point of three bones. Meeting point of three bones. Yes, meeting point of three bones. And which three bones are there? You already know. We have the parietal bone, occipital bone. Yes, very good, very good. And we have the which part of the temporal bone, guys? It is this part of the temporal bone. Can anyone tell me? It is temporal bone only, but behind wala part, what it is called, guys? Anyone in the chat box? It is which part of the temporal bone? Very good, Ankita Gain. Very good. It is the mastoid part of the temporal bone. So specifically, if I have to write, it is the mastoid. Ishita, very good. Mastoid part of temporal bone. Mastoid part of the temporal bone. Now, at birth, guys, at birth, this area, okay, it is again like occupied by a membrane, and that is called as the mastoid fontanelle. Obviously, it is the mastoid part, so it is named as mastoid fontanelle. Or if guys, this is anterolateral. If this is sterion, it's like anterolateral. This asterion will be, it is on the posterior side and on the lateral side only. So this is also called as posterolateral fontanelle. It is also called as posterolateral fontanelle. It ossifies at age of 3 months. Ossified at age of 3 months. Right? Now what is the importance, guys? In adults, it is related internally to highest point of transverse sinus. I'll be discussing the sinus, but as of now, just remember it is internally related to the highest point of the transverse sinus, right? टेरियन, इट इज द एंटीरियर ब्रांच ऑफ द मिडिल मेनिंजियल आर्टरी. बिल्कुल इसके सेंटर में, इसके पीछे आपको एंटीरियर ब्रांच मिलेगी मिडिल मेनिंजियल आर्टरी की, और इसी एस्टीरियन के पीछे आपको मिलेगा द हाईएस्ट पॉइंट ऑफ द ट्रांसवर्स साइनस. Highest point of the transverse sinus, guys. Again, these two are very very important, the terion and the asterion. I hope guys this is clear. Just give me a thumbs up if both the important landmarks are clear to you. If both the important landmarks are like clear to you, फटाफट से चलो एक थम्स अप दे दो जल्दी से. Venkatesh, Shehbaz, Momin, very good guys. Now, apart from that, guys, we are going to focus on one more important thing over here. Yes, we are going to focus on one more important thing. Chalo, Abdikar, very good. What about rest, guys? Yes. Chalo. Mastoid fontanelle turns into, yes, 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 yes. Very good, very good. Now, now guys, I am gonna talk about, yes, a very, very important triangle, and that is something, guys, you have to like focus over here. I'm talking about this triangle, guys. This triangle. On the lateral view, you can see this triangle, guys, over here. And remember, guys, this is an important landmark over here, guys. Now, this is called as the suprameatal triangle. Suprameatal triangle. Now, what is the suprameatal triangle, guys? You already know कि बेटा ये वाला जो पार्ट है दैट इज द एक्सटर्नल अकाउस्टिक मियाटस. ये तो आप लोग को पता ही है. दिस इज द एक्सटर्नल अकाउस्टिक मियाटस. मियाटस का मतलब क्या होता है? ओपनिंग. एक्सटर्नल ऑडिटरी कैनाल ओपनिंग. एक्सटर्नल ऑडिटरी कैनाल ओपनिंग. Just behind this, guys, you can see this triangle, and that is called as the suprameatal triangle. Now, guys, you guys are going to tell me the superior boundary. It is formed of which process, guys? What is this process of the temporal bone? The superior boundary, it is formed from which process, guys? Which crest is this? If I just ask you, yes, हाँ, ठीक है, बट ये ऑब्वियसली कौन सा क्रेस्ट है बेटा? यस, इट इज द सुप्रा मेस्टॉइड क्रेस्ट. ऊपर वाला बाउंड्री जो है, ठीक है, मेस्टॉइड नीचे है, मेस्टॉइड प्रोसेस है ये पूरा का पूरा, और ये सुप्रा मेस्टॉइड ऊपर एक क्रेस्ट बताया था ना मैंने आप लोग को. यस, द सुप्रा मेस्टॉइड क्रेस्ट. यस, देखो मेस्टॉइड पार्ट है और ऊपर बिल्कुल एक थिक लाइन देखने को मिलती है. ठीक है, इसको बोलते हैं सुप्रा मेस्टॉइड क्रेस्ट सुपीरियरली. अच्छा, एंटीरियरली बताओ ये क्या प्रेजेंट है? चलो एंटीरियरली आगे की तरफ इस ट्राइंगल में देखो क्या प्रेजेंट है. जल्दी से बताओ आगे की तरफ क्या प्रेजेंट है. इशिता, ठीक है, आगे की तरफ क्या प्रेजेंट है? एक्सटर्नल अकाउस्टिक मियाटस. एक्सटर्नल अकाउस्टिक या एक्सटर्नल ऑडिटरी मियाटस का ये कौन सा पार्ट है? एंटीरियर है कि पोस्टीरियर है? आगे की तरफ यू हैव दिस एक्सटर्नल अकाउस्टिक मियाटस. ठीक है, अब एक्सटर्नल ऑडिटरी मियाटस या अकाउस्टिक मियाटस का कौन सा पार्ट इसका इस ट्राइंगल का एंटीरियर बाउंड्री बनाएगा? इशिता, वेरी गुड, इट इज द पोस्टीरियर. ऑब्वियसली बात है कि एंटीरियर वाला तो आगे की तरफ ये हो गया, तो ये तो पोस्टीरियर वाला ही हो गया ना. पोस्टीरियर पार्ट ऑफ द एक्सटर्नल ऑडिटरी मियाटस, राइट? वेंकटेश, वेरी गुड. पोस्टीरियर पार्ट, आगे तो ये एंटीरियर हो गया, ये पीछे वाला पोस्टीरियर ही होगा, राइट? अब inferiorly, guys, you already know, yes, we have a line that is like going to the posterior margin of this meatus, and that is called as the tangent line, right, to the posterior margin of the meatus, right? That is something you have to remember, guys. Let us just try to focus on this, the third one, the suprameatal triangle. Suprameatal triangle. So remember, guys, it is a triangular area. It is a triangular area just above and behind, just above and behind external auditory meatus. Please write down completely. It is external auditory meatus. Now, guys, boundaries you already know. Boundaries you already know. Yes. So superiorly, supramastoid crest. Then we have anteriorly, triangle का आगे वाला हिस्सा, it is formed by the posterior margin of external auditory meatus, and inferiorly, or I can say no, like posteriorly, guys, it is the tangent line. McEwen's triangle. Yes, very good. Yes, it is also called as the McEwen's triangle. Tangent line that is like to the posterior margin of the meatus. Now guys, why this is very very important, guys? बेटा tangent line, बेटा अगर तुम ध्यान से देखोगे इशिता, it is just like okay, let me just try to show you. Obviously it will be like not visible, but it is just like this tangent line which is like going behind this posterior margin of the meatus. This is the line, guys, right? This is the line. So that is tangent. If you have drawn a circle, guys, now if from any point if you draw a line, that is called as tangent. That is called as tangent, guys. So that is a tangent which is like passing through the posterior margin, like the tangent of the circle, right? The tangent of the circle. That is the tangent, beta. समझ में आया इशिता? Now, guys, why this is very very important? Remember that it forms lateral wall of mastoid antrum. Mastoid antrum, or it is also called as the tympanic sinus, guys. The tympanic mastoid air cells are present behind this area, guys. Yes, it is like the mastoid air cells are present behind this. Again, guys, to reach the middle ear. Okay. Now, guys, again a very important question over here. If I ask you, we have the three parts of ear: external ear, middle ear, and internal ear. Now the surgeons can reach the middle ear via like opening from the outer ear, also external ear also. But obviously, guys, we have the innermost part of the external ear as cartilage. It's a very very narrow part. So obviously, if we try to reach through the external ear into the middle ear, we won't be able to reach. The ears will collapse, right? Because the cartilaginous part is very very narrower. So the surgeons like use this particular triangle to reach the middle ear, guys. Okay, a drill hole. Basically, the surgeons like make a hole. Okay, above this triangle, to enter the middle cranial fossa also, and yes, obviously then also to this middle ear also, right? Middle ear also, right? So that is something very very important that you have to remember. I hope this is clear, everyone. Just give me a thumbs up in the chat box if this is clear to everyone over here right now. One important landmark, guys, you already know we have this external acoustic meatus. I even don't need to tell you the external acoustic meatus. That is again you can very well found on the lateral aspect. The fourth one, we have the external auditory meatus or acoustic meatus. चलो फटाफट से अभिषेक शाह, very good. What about rest, guys? Are you all alive? Let me know external auditory meatus. Now, again, guys, what will be the boundaries of this? What will be the boundaries of this, guys? चलो. Yes, beta. Obviously, you will be discussing it in the ear part as well. Ishita, very good. What about rest, guys? Are you all alive? चलो. नाउ गाइस, इसकी अगर बाउंड्री की बात करें, इसकी अगर बाउंड्री की बात की जाए, so you are very well aware कि I'm just talking about the boundaries of this external auditory meatus. Now, if you can very well see, guys, now posterior superiorly we have this. Okay, which part of the part? It is the squamous temporal bone, right? It is the squamous temporal bone. Antero inferiorly we have the tympanic part. This is the Yeah, the tympanic part of temporal bone, right? This is the tympanic part of the temporal bone, and posteriorly it is like, yes, the posterior superiorly bisquamous part of the temporal bone, right? This is the squamous part of temporal bone. Yes. Shebas, I cannot increase in this, but yeah, I will have to. इससे बड़ा तो क्या ही होगा, right? So just you have to remember, yes, the external auditory meatus. No need to remember such boundaries, right? Okay. One more thing, guys, over here that we have to discuss, that is the mastoid. Okay, it is the mastoid part. Now, can you just see, guys, over here? Yes, this is the mastoid process. Mastoid process. This is the mastoid process. Basically, beta, remember, beta, it is a nipple-like process. It is a nipple-like process deep to the lobule of the ear. Okay. Now, this mastoid process is very, very important. Again, the mastoid process. Below the lobule, this is the lobule where the subcutaneous fat is present. This is the lobule of the ear where no ear piercing is done because the subcutaneous fat is there. And below this lobule, guys, you will find this mastoid process. Okay, felt subcutaneously deep to the lobule of the ear, right? Now, guys, over here, the mastoid process, outer surface. The outer surface, beta, remember it gives insertion to three muscles. Insertion to three muscles over here, right? From before backwards, like we already know this. We have like three muscles, guys. We have the sternocleidomastoid muscle, the splenius capitis muscle, and longissimus, yes, capitis muscle. We have three muscles like inserted on this part. We have like three muscles that are inserted on this part, right? So we have the sternocleidomastoid. I've already told you this is this muscle which is going towards the mastoid antrum. So we have sternocleidomastoid muscle. Please write down the attachment. I will be like discussing it. Yes, we have the splenius capitis muscle. We have the longissimus capitis muscle. Yes, 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 yes. Everyone is right. We have one process, guys, over here, and I hope you can appreciate. Can anyone tell me which process is this? Which process of temporal bone is this? The one which is projecting over here. Can anyone tell me which process of temporal bone is this? Venkatesh says styloid process. What about rest, guys? Yes. It is the styloid process of temporal bone. It is the styloid process of temporal bone. Yes, Abukar, very good. It is the styloid process of temporal bone. So remember, guys, we have like the sixth one, styloid process. It is a thin, long projection from temporal bone. Okay, it is a thin, long projection from temporal bone, right? So it gives attachment to two muscles and three ligaments, guys. It gives attachment to two muscles and like three ligaments. So remember, guys, yes. Hmm. Again, it is like okay. Yes, 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 guys. Very, very important. It is giving like attachment to two muscles and Okay, not two muscles. Yeah, the three muscles and two ligaments. Yes, we have the styloglossus muscle, styloglossus muscle, stylohyoid muscle, stylohyoid muscle. We have stylopharyngeus muscle, guys. Stylopharyngeus muscle. Okay. We do have two ligaments, guys. We have stylomandibular ligament, stylomandibular ligament, and we have stylohyoid ligament, stylohyoid ligament, right? So that is something you have to remember. Yeah, that is about the styloid process. We also have the pterygomaxillary fissure, right? Just want we can also see a fissure over here, guys, in the anterior aspect. Yes. Yes, in front of this, it is the pterygomaxillary fissure. Beta, you will be remembering Ishita. Okay. Shebaz, I will be like sharing you some mnemonics, but okay, just remember one thing, guys. As of now, we are just discussing like one part over here, right? Normal lateralis. What all comes in the normal lateralis? I'm telling you. Again, we are going to discuss the bones separately, the landmarks. I mean, not the landmarks, the bones separately. Again, all the muscles I will be teaching you in detail. Once you are doing right now, again when I will teach you the bones, then also muscles you will do. Again after bones, I will be teaching you independently all the muscles, then again muscles you will revise, like three times in a row, guys. One with the aspects of the skull, one with the bones, one with the muscles, I mean independent topic of the muscles, right? So that will be like multiple times you will be studying it, and we'll be focusing on the area multiple times, so it will not, you won't be able to like yeah, you won't be able to, yes, no need to ratify anything, just try to like revise it multiple times along with me. Okay, so yes, so we have the, okay, we have something called as the pterygomaxillary fissure, but I will all not tell you right now much more, otherwise you will be like we have the pterygopalatine fossa also, so we will be like discussing it, guys. Yes, we have a fossa also, that is called as the, okay, we have the pterygopalatine fossa beta over here. That is again an important landmark that you will be like watching over here. So beta, if you just see, it is like an small inverted, right, pyramidal shaped space. Okay, lying medial to the pterygomaxillary fissure. We have a fissure over here. Okay, so anteriorly it is the posterior wall of the maxilla. Like the boundaries beta. What you see, you just remember which wall of maxilla it is. Posterior wall. Anterior wall is this. Posterior wall of maxilla will form the anterior wall of the pterygopalatine fossa. Posterior part will be formed of this particular fossa. It is which bone? Sphenoid, right? The posterior wall will be formed by the sphenoid. Medially, we have the perpendicular plate of palatine bone. Laterally, we have like the pterygomaxillary fissure, which you can see, right? So yes, over here, okay, this pterygopalatine fossa, remember guys, we have maxillary nerve and artery passing through this. Maxillary nerve and artery, like which are passing through this, right? The terminal part of the maxillary artery, okay, we have the spinopalatine ganglion, right? Like obviously over here. So as of now, just try to like focus on the main aspects that we have discussed. Yeah, it is like too much, but anyways, we have to like discuss in one time. We have discussed this. Again, I will be discussing each bone separately. Then also you will be like encountering with the same part. Now guys, let us start with the normal Basalis externa. Please let us start with the normal Basalis externa. So just give me a thumbs up guys. At least the important parts, please try to remember. Not all I would say, but at least the important ones which we are going to discuss right now. Just give me a thumbs up guys in the chat box if you are aware. Yes. Present over here. Yes. At least just try to focus on the important aspects. Now guys, when I say normal Basalis externa, what does it mean? The outer surface of skull base. Outer surface of skull base, and I hope you can very well see. We have just turned the skull like this and we are watching it, what is there. Right? It is the outer surface of the skull base. We are watching the skull base, the outer part of the skull. ये बिल्कुल बेस है स्कल का और बिल्कुल बाहर वाला पार्ट है, अंदर वाला पार्ट नहीं देख रहे हैं, इसलिए एक्सटर्ना बोलते हैं इसको. एक्सटर्ना मतलब एक्सटर्नल पार्ट देख रहे हैं, ठीक है. और ये एंटीरियर पार्ट होगा और पीछे क्या हो जाएगा, ये पोस्टीरियर पार्ट होगा. गाइस बी वेरी वेरी क्लियर विद दिस बिकॉज दिस इज लाइक वेरी 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 इंपॉर्टेंट. Now for descriptive purposes guys, the Norma Basalis externa, it is divided into three parts by two lines. It is divided into three parts by two lines guys over here. One line guys, these are two imaginary lines that I am drawing guys right now. And I will be like studying this Norma Basalis externa over here only, right? Okay, we have like two lines. One it is passing like this and one it is passing like this. You guys are going to tell me which is the anterior line and which is the posterior line. Which is the anterior line and which is the posterior line. These are two imaginary lines first of all. These are imaginary lines. So you are going to tell me which is the anterior transverse line and which is the posterior transverse line. Teeth are present. Yes, Venkatesh, very good. A, it is the anterior transverse line. And B, it is the posterior transverse line. It is dividing it into three spaces, guys. The three parts actually, the three parts. And we have to study these three parts over here, right? We have this anterior transverse line. It is along the posterior border of the hard palate. This line we have drawn along the posterior border of the hard palate. We'll be discussing it. What is the hard palate, soft palate, everything. We have the posterior transverse line basically passing through the posterior border. Okay, which foramen is this, guys? Which foramen is this? And you already know this line, it is passing through the posterior border of this foramen. Which foramen is this? चलो फटाफट से बता दो. ये तो बताया है तुम्हें, ये तो बताया है तुम्हें. ये कौन सा foramen है? Yes, Ankita, very good. It is foramen magnum. It is foramen magnum. It is foramen magnum. So the normal Basalis externa, it is basically divided into three parts. We have the anterior part, we have the middle part, and we have the posterior part. We have the anterior part, middle part, and posterior part. We have the anterior part, middle part, and posterior part. Right? We are going to discuss these three parts in detail, guys. Yes, it is the foramen magnum. It is the foramen magnum. Now, let us first, I will be focusing on the anterior part, then the middle part, and then I will be coming to the basilar part. Then I will be like coming to the basilar part. I mean, the posterior part. I'm just taking the anterior part out of it, and let us just try to see what all structures I can see over here. Now, the anterior part, it is formed by, so I am discussing the anterior part. Let me just write it over here because I will be labeling it also. Yeah. Anterior part of normal Norma Basalis externa. Norma Basalis externa. Let us at least just try to identify the structures, what all structures are present. Now guys, this part, it is called as the hard palate. It is called as the hard palate, okay, which is bounded by these teeth, right? These are the teeth, and teeth are basically, they are fitted into the alveolar arches, right? We have the arches, it is forming an arch like this, right? Carrying sockets, right? It is like this arch, guys. It is an arch which is carrying these sockets. Arch है ना, arch, U-shape arch होता है, and these are carrying these sockets, okay, for the roots of the upper teeth, right? Now guys, this entire is the hard palate. It is divided, okay, by the median palatine suture, guys. Remember guys, this suture which you can see over here, it is called as the median palatine suture. Very, very important. It is called as the median palatine suture, okay, into right and left half. They are divided, it is dividing, it is in the midline, guys. It is dividing into, yes, the right and the left half. Now guys, remember that, okay, हाँ ठीक है, अभी देखो इसको. This median palatine suture, it is dividing it into this right and the left half, right? You can very well see over here. But over here also, you also have to see one more important structure, right? That is called as the palatomaxillary suture. Now, this part which I have highlighted beta, it is the part of the maxilla bone only. It is the part of the maxilla bone only. And remember, it is called as the palatine part of the maxilla bone. It is called as the palatine part of maxilla bone. It is forming the palate. That's why it is called as the palatine part of the maxilla bone, right? It is called as the palatine part of the maxilla bone. And this part, remember, beta, it is called as the palatine bone. This is the palatine bone, guys. This is the palatine bone we have already discussed. So anterior 3/4, it is the palatine part of the maxilla bone. It's the part of maxilla bone only, but behind we have the palatine bone, right? These two parts basically they unite at a suture, guys, which you can see over here. And this suture, it is called as palatomaxillary suture. Obviously, the name itself suggests, guys, द पैलेटाइन पार्ट ऑफ द मैक्सिला बोन है आगे और पीछे क्या है पैलेटाइन बोन. तो ये जो सूचर होगा पैलेटो मैक्सिलरी सूचर होगा, पैलेटो मैक्सिलरी सूचर होगा. So I hope this is clear, guys, to everyone. At least these parts are very, very clear to everyone. Just give me a thumbs up. Yes. So we have the median palatine suture which divides into right and left half, and anterior 3/4 and posterior 1/4. Anterior 3/4, it is by the palatine part. It's the maxilla bone only. Which part of the maxilla bone? The palatine part. And behind we have the palatine bone, right? These palatine bones are there. The palatine bones are there. Okay. Yes, Venkatesh, very good. What about rest, guys? Everyone else alive? चलो फटाफट से बाकी सब बताओ. Alive हो? No. Now guys, if you just clearly see, Ishita, very good. Ishita, very good. The anterior border, it is like not free, guys. But if you clearly see, the posterior border, it is like free, guys. The posterior border is free, or I can see very well, it is the posterior. बेटा आगे यही है, anterior यही है, posterior ये पीछे वाला होगा. It is the posterior border, or I can see the free border of hard palate. Free border of hard palate. Yes, it is the posterior free border of the hard palate. Anterior वाला तो बेटा आगे fused है. बट पोस्टीरियर वाला फ्री है बेटा, ये बहुत ही ज्यादा शार्प होता है. ओके, इट गिव्स अटैचमेंट टू द पैलेटाइन एपोन्यूरोसिस ऑफ सॉफ्ट पैलेट. ऑब्वियसली बात है ये सॉफ्ट पैलेट ही है, ठीक है. सो यस, तो ये एपोन्यूरोसिस को अटैचमेंट देता है. सो लेट्स नॉट लाइक. We also have one more structure. It is like not much visible over here, but if you just try to focus on this particular structure, guys, I hope you can see over here. Yes, it is called as the posterior nasal spine. This structure, it is called as the posterior nasal spine. Anterior nasal spine भी होता है, वो आगे की तरफ है बेटा, वो आगे की तरफ होगा. ये हम पीछे जा रहे हैं, ठीक है. So we have the posterior nasal spine also. We have the posterior nasal spine. I will be coming to the foramen, no need to worry. Okay, I'll be coming to the foramen. Yes, we also have a crest beta over here, and that is called as the palatine crest. If you just want to see, guys, this, yes, this is called as the palatine crest. Palatine crest. Now this palatine crest, guys, this palatine crest, it is basically dividing it into two parts over here, beta. The palatine crest, it is a transverse ridge, right? Behind this, you already know it is palato-maxillary suture, right? This suture, it is behind the suture, guys, right? Opposite to the last molar tooth. And this is something like giving rise to the two foramens over here. One is this, guys, and one is this. If you just want to see, there is one foramen in front of this crest and one behind this crest. One in front of this and one behind this. If you can just see, this is one in front of this and one behind this, guys. Greater palatine foramen. Greater palatine foramen. And we have the lesser palatine foramen. Yes, I hope everyone can appreciate this foramen, guys. Just give me a thumbs up in the chat box if you can very well appreciate the foramens. Right, the greater and the lesser palatine foramen, the greater palatine foramen and the lesser palatine foramen, and it is by dividing by this palatine crest, right? That is something you have to remember. Let me just mark it like over here. So this is the palatine crest, dividing it into greater and the lesser palatine foramen, right? Now, okay. Now, guys, this part, it is the part of, yeah, we have a tuberosity, guys, just behind the alveolar arch. Okay, and this is called as, yes, you already know, it is called as the maxillary tuberosity. Maxillary tuberosity. Maxillary tuberosity. Now, when I say maxillary tuberosity, guys, you already know, you have heard the term tubercle, tuberosity, and trochanter. Tubercle, tuberosity, and we have trochanter. Tuberosity is a rounded projection, guys. A rounded उभार, एक मतलब उभार है. ट्यूबरकल छोटा होता है, tuberosity एरिया में उससे थोड़ा सा ज्यादा होगा, ठीक है. And that tuberosity which you will see just behind this tooth, it is the maxillary tooth. Now, guys, why this maxillary tuberosity is like very important? Remember, guys, over here it gives origin to superficial head of medial pterygoid muscle. Medial pterygoid muscle. It gives origin to the superficial head of the medial pterygoid muscle, right? That is the origin part over here. That is the origin part. Now, if we come to the foramen, guys, you already know. Okay, can anyone tell me which foramen is this? Yes, this is the Yes, you guys are very well aware that this is the incisive foramen, right? Now, if you can very well see over here, yes, that is called as the incisive fossa, incisive fossa, right? At the anterior part of this intermaxillary suture, right? You already know the median palatine fissure. Okay, we have this fossa that is called as the incisive fossa, right? And yes, it is transferring the spinopalatine nerves. Okay, and yeah, that is something you have to remember. The greater palatine foramen and the lesser palatine foramen. Now, can anyone tell me what will pass through the greater palatine foramen? If we just want to mention over here, guys, yes, the greater palatine foramen. Okay, it will be like, okay, it will be from this, you already know one artery will be passing. Yes, greater palatine artery, and it will be like going in front, supplying the hard palate. Yes, and the one which will be like going behind. Yes, it's a soft palate, right? So we have the greater palatine artery, vein, and nerve, right? And the lesser palatine foramen, it will also like supply the lesser palatine nerve, artery, and vein. Yes, artery and vein. So that is about the anterior part, guys. You just have to remember the parts, right? The okay, let us just revise. We have the median palatine suture, right? And this yellow colored area, it is the palatine part. It's forming the palate, but it is what part? It is the maxilla bone only. So that is called as the palatine part of maxilla bone. Behind, guys, we have the palatine bone, which is like in between we have a suture, palatomaxillary suture. We have the crest, guys. We have the crest, right? And it is dividing like one in front of the crest we have the greater palatine foramen, behind the crest we have the lesser palatine foramen, right? So yes, over here the all the arteries, nerves and veins will be passing. चलो इतना clear है सब लोगों को? Just give me a thumbs up, guys, in the chat box if this is clear to everyone over here, if it is clear to everyone over here. Hmm. Hmm. Now, guys, let us just try to focus on the middle part of the normal Basalis externa. The middle part of the normal Basalis externa. So I will be like focusing on this part right now. You already know this is one of the lines, and this is like the other lines which you can see over here. Let us first see what all we have discussed the anterior part, right? Now we are going to discuss the posterior part over here. I mean the middle part, and we have the posterior part. So right now I will be focusing on the middle part of Norma Basalis externa. Sure. Now, guys, anteriorly in the middle, we have this bone over here. If you can just appreciate, guys, this is called as the vomer bone. This is called as the vomer bone, right? And guys, remember, we have something. Yes. Yes, this is the vomer bone, guys, right? And you already know we have this part. Okay, yellow, it is which bone, guys? This yellow wala bone, it is which bone, guys? This yellow colored bone which you can see. Can anyone tell me the name of this bone? Because I've already told you very clearly. It is having greater wings, guys. Yes, Ankita, very good. It is sphenoid. And the middle part of the sphenoid bone, it is called as the body of sphenoid. It is called as the body of the sphenoid. Body of sphenoid. Right? So that is something in the middle part you can very well see over here. All the bones which you can see over here. Right? Even in this you can see this is the occipital bone. This blue color, it is the occipital bone. And which part of the occipital bone it is? Yes, it is the basilar part of the occipital bone. It is basilar part of occipital bone. Occipital bone. You can see the foramen magnum over here, and we have the basilar part of the occipital bone. Right? I will be discussing first bones, then foramens, then muscles, everything about what we can see in the external part, I mean, of the skull. Like, yeah. Now, guys, over here, if you just see, yes, we have the two processes over here. Hmm. We have the two processes, two parts of the bones, like they are coming out, and this is called as the, yes, the pterygoid process. The pterygoid process, guys, right? We have the pterygoid process. Pterygoid process, right? Now, guys, can anyone tell me which part is this that I have highlighted right now? Yes, which part is this, guys? The yellow colored part. Anyone in the chat box? फटाफट से बता दो, ये मैं बता चुका हूँ और ये दोनों साइड से दिखता है. Hmm. Yes, greater wing of the sphenoid bone. Yes, greater wing of the sphenoid bone. So in totality, guys, you already know about this, right? Hmm. You already know. Yes, this part, it is the temporal bone, and especially it is the mastoid part of the temporal bone. Mastoid पीछे की तरफ होता है ना? We have the mastoid part of temporal bone. We have also, yes, the tympanic part of temporal bone. Tympanic part of temporal bone. Yes, we have the tympanic part of temporal bone. And yes, this part specifically, it is the petrous part of temporal bone. Petrous part of temporal bone. Now, let us just first try to discuss some important features over here, right? चल इसको पहले ध्यान से देखते हैं. Let us just try to learn, guys. No need to like ratify. Let us just try to learn. Okay. You guys are going to tell me the names. Okay. Which foramen is this? Which is marked with A, and which foramen is this which is marked with B? You guys are going to tell me. What is A and B in the chart? Let us just try to understand this. Guys, we have the posterior nasal choana or opening. Hmm. Yes, greater and lesser. Very good. Shebaz, very good. Yes. Venkatesh, very good. We have the palatine fossa. Yeah. Right. Now, guys, over here in the middle part, if I just want to highlight, guys, you can just see these openings over here, and these are nothing but the posterior nasal openings. These are also called as choana, right? Posterior nasal openings, and these are also called as choana. Basically, they are separated from each other by a bone over here. And can anyone tell me the name of this bone, guys? You already know the name. The posterior nasal choana, basically, they are separated by each other with the help of a bone. Yes, that is called as, yes, the vomer bone. चलो, तो पता है तुम लोगों को कि ये वोमर है. चलो चलो, it is the vomer bone, right? Now, vomer basically it is a median vertical bony plate which you can see, right? Intervening between the two, we have the, yeah, posterior nasal choana here and the posterior nasal choana over here, the two openings, and in between we have the vomer bone, right? So yes, that is something you have to remember, guys. That is something you have to remember. Now, now, guys, we have the pterygoid plates. Okay, we have the pterygoid plates, guys, and you guys already know the name of the pterygoid plates. Okay, now, guys, you guys are going to tell me which one is the medial and which one is the lateral pterygoid plate. These are pterygoid plates of sphenoid bone, and you guys are going to tell me which one is the medial. Let me mark it as A and let me mark it as B. Which one is the medial and which one is the lateral pterygoid plate? Now, guys, you already know we have the midline in between. Midline is like this. One, the plate which is like coming closer to the midline will be the medial pterygoid plate. Medial pterygoid plate of which bone? Of sphenoid bone. And we have the lateral, which is away from the midline as compared to this. It is the lateral pterygoid plate. Lateral pterygoid plate. Right? It is the lateral pterygoid plate. So I hope this is clear, everyone. चलो, मीडियल टेरिगॉइड प्लेट समझ में आ गया, लेटरल टेरिगॉइड प्लेट समझ में आ गया. ये वाला पार्ट कौन सा है स्पिनॉइड बोन का? फटाफट से बताओ, ये कौन सा पार्ट है स्पिनॉइड बोन का जो मैंने अभी हाईलाइट किया है? जल्दी से बताओ. हम्म. I'm waiting for your answers. Yes. The body of what? Body of the sphenoid bone. पूरा बताना है. अंकिता, हाँ बिल्कुल ठीक है. इशिता, वेरी गुड. It is the body of the sphenoid bone. ठीक है, it is the body of the sphenoid bone, right? हम्म. चलो, ये भी ठीक है, right? So yes, this is the mastoid process, beta. Please just try to see. This is the mastoid process of temporal bone. Mastoid process of temporal bone, right? Mastoid process. This green wala area, yes. चलो, हाँ ठीक है. बॉडी ऑफ स्पिनॉइड बोन, इशिता बिल्कुल ठीक है. बिल्कुल बिल्कुल ठीक है इशिता. तो मुझे फटाफट से बता दो कि ओके, ओके, ये कौन सा पार्ट होगा इशिता? दिस इज विच पार्ट ऑफ टेम्पोरल बोन? बिल्कुल मीडियली जो पार्ट लोकेटेड है. और इन दोनों फोरामेन के आगे भी ये वाला जो पार्ट है, ये कौन सा होगा? देखो, जो बिल्कुल मिड लाइन के ज्यादा पास है, दैट इज कॉल्ड एज द पिट्रस पार्ट ऑफ टेम्पोरल बोन. पिट्रस पार्ट ऑफ टेम्पोरल बोन. और ये वाला जो पार्ट होगा, दैट इज टिम्पैनिक पार्ट ऑफ टेम्पोरल बोन. इट इज टिम्पैनिक पार्ट ऑफ टेम्पोरल बोन, राइट? इट इज टिम्पैनिक पार्ट ऑफ टेम्पोरल बोन. ठीक है वेंकटेश. इशिता, आप थोड़ा व्यू बिगर है तो आई थिंक समझ में आ रहा होगा. अंकिता, ठीक है, ठीक है. ये ग्रीन वाली टेम्पोरल हो गई ना बेटा, ग्रीन वाली टेम्पोरल हो गई. ठीक है, दैट इज समथिंग यू हैव टू रिमेंबर ओवर हियर, राइट? हम्म. Now, okay guys, let us just try to see certain foramens over here. If we have already discussed, let us just try to focus on certain foramens now over here. We are very, very important, guys. Now, over here, you can see one of the foramen beta. Okay. Now, this foramen beta, it is basically okay. We have the sphenoid bone, right? Okay, this is the occipit, the basilar part of the occipital bone. We have the sphenoid bone, and you already know we have the temporal bone. Okay, we have the temporal bone. In between, if you can just see this foramen, which I'm like highlighting, this particular foramen, guys, this particular foramen, this is called as foramen lacerum. Very, very important. It is called as foramen lacerum. So foramen lacerum basically lies between the apex part of the petrous temporal bone. If you can just see, it is the petrous part of the temporal bone, right? Right, the apex part, right? Pterygoid processes, you already know we have the medial pterygoid plate and the lateral pterygoid plate of the sphenoid bones. Yes, you can see the medial and the lateral pterygoid plate. So it is just a like below the medial, behind the medial pterygoid plate. Okay, and we have the basilar part of the occipital bone. Yes, just behind this, just lateral to this, guys. You can see this, right? So that is the foramen lacerum, guys. That is the foramen lacerum, right? चलो इतना क्लियर है फोरामेन लेसीरम का तुम्हें पार्ट पता चल गया सब लोगों को जल्दी से बताओ मुझे the lateral pterygoid place often basically it is ending it into a tubercle guys over here and that is called as the yes the pterygoid tubercle this yellow part it is called as the pterygoid tubercle pterygoid tubercle over here right pterygoid tubercle hmm chalo very good I think the boundaries are very very clear to each one of you yes चलो इतना क्लियर हो गया सब लोगों को नाउ can anyone tell me what is passing through this foramen lacerum? So that you guys will be like telling me. Okay, this is the occipital bone, guys, and we have like two condyles insides of the foramen magnum, and these are called as occipital condyles, which actually form the joint with the first cervical vertebra, which forms the joint with the first cervical vertebra, right? Yes. We have the foramen magnum in between, guys. Yes. Yes, the posterior part, guys, you already know it is basically formed from the yes, we have the external occipital protuberance. We have the external occipital protuberance, guys. Yes, the external occipital crest, right? The crest like going behind, right? We have the nuchal lines that we have already discussed yesterday. We have the nuchal lines, the superior nuchal line, right? In the occipital bone, we have already discussed it, right? So that is the inferior nuchal line. We have discussed this, right? We have the superior nuchal line, the inferior nuchal line, and just 1 centimeter above, we have the highest nuchal line. The highest nuchal line. That is like we have already discussed this, right? Now, You already know this is the foramen magnum, right? This is the foramen magnum, which you can see over here, right? And that is something you already know. The occipital condyles are there, which forms the joint with the first cervical vertebra just lateral to the foramen magnum. Okay, and that is something like you have to remember a bit over here. Now, guys, again, something very important that I wish to discuss with you, and let us just focus on the foramina, guys. Right? Hmm. In the greater wing of the sphenoid bone, let us just try to focus over here. Now, guys, in the greater wing of the sphenoid, okay, greater wing you can very well see over here, right? We have a foramen, guys, right? The greater wing is this, the greater wing is this, right? Can you identify this foramen, guys? This big foramen in the greater wing of the sphenoid bone, right? Posterolateral to the posterior margin of the pterygoid plate. You already know we have the medial pterygoid plate and we have the lateral pterygoid plate. Just lateral to this lateral pterygoid plate, posterior margin, we have this foramen, guys. Can anyone tell me the name of this foramen? Yes, that is called as the foramen ovale. That is called as the foramen ovale. And just try to remember, guys, this foramen ovale. Yes, we have like the three. Yes, foramen ovale, very important, guys. You have to just write all the foramens, guys, which is very important. Yes, in the middle part, we have three foramens. Three foramens. Okay, small foramens in the middle part, right? The first one, remember, we have the foramen ovale. Foramen ovale, you can just remember by the mnemonic male. Male. Now, guys, M, you have to write M three times and then ale. Yes, we have the mandibular nerve. What is passing through this foramen? It is the mandibular nerve, right? We have another, that is the motor root of trigeminal nerve. We have the middle meningeal vein. Middle meningeal vein. We have accessory meningeal artery. Accessory meningeal artery. And we have the lesser superficial petrosal nerve. Okay, and we have the emissary veins. Emissary veins. We have the emissary veins, guys, over here. We have the emissary veins over here, right? So this is something which is passing through this foramen ovale. The second one, guys, remember, if you can just see just on the sides of this, guys. Yes, we have this small foramen, guys. This small foramen just on the sides in the sphenoid bone. This is called as foramen spinosum. It is called as foramen spinosum, right? It is called as foramen spinosum. So please remember we have foramen spinosum also. And remember over here the middle meningeal artery is passing. Middle meningeal artery is passing. And yes, just posterolateral to foramen ovale, we have foramen spinosum, right? After that, guys, we have one more foramen in this part. One more foramen, if you can just appreciate, guys, this big foramen in the temporal part, right? Between the styloid and the mastoid process, guys. This foramen, yes, it is. No, not this one. Hmm. We have the stylomastoid foramen between the styloid process and the mastoid process. This is the mastoid process, and this is the styloid process. So we have the stylomastoid foramen, stylomastoid foramen. Remember, basically in the stylomastoid foramen, basically facial nerve is passing, and stylomastoid artery is passing. Stylomastoid artery, basically it is a branch of the posterior auricular artery. Remember, beta, it is a branch of posterior auricular artery. So that is yes, like the three foramens that we have to the small foramens in the middle part. We also have the large foramens, guys, in the middle part. The large foramens. Now, if I just want to, yes, if we just want to appreciate, guys, what are the large foramens? Yes, the one which you already know. Yes, this foramen, guys. Can anyone tell me the name of this foramen? Can anyone tell me the name of this foramen, guys? We have just discussed. Hmm. नहीं बेटा अभी फोरामेन लेसीरम बताया था ना foramen lacerum. Yes, Ishita, very good. We have the foramen lacerum, guys, right? So, meningeal branch of the ascending pharyngeal artery, emissary veins, all these are passing from this, right? Hmm. Guys, remember we have the carotid canal. It is in the petrous part of the temporal bone. We have this carotid canal in the petrous part of the temporal bone. Yes. And the third one, guys, you already know we have a foramen over here that is called as the big foramen over here, that is the jugular foramen. Jugular foramen. Obviously, the jugular foramen, the internal jugular vein will pass through it, right? The inferior petrosal sinus will be there, right? And that is something you have to remember. Okay. So yes, that is like sufficient for today, guys. We have already discussed a lot of parts, right? So again, this is like very, very tough, but I will be discussing like independent bones from tomorrow. I will be discussing each bone in detail along with the parts, along with the muscle attachments, along with the nerves, along with the applied anatomy. Each bone I will be like teaching you separately. All the cranial nerves. Then this part will be like more easy to you people. Then this part will be like more easy to you people because at now I know it is very difficult to remember all the nerves, all the vessels or the arteries, like which one is passing through which foramen and this. Again, guys, it will become very easy once we like discuss the independent bones. Again, as the lecture will go on, you will be like um, getting up into all those things again and again, and that will be like a key point in revising all this, right? So yes, for notes you can just go into my Telegram group, that is Docs Mayan, right? This is my Telegram group, and for questions you can just write me on my Instagram ID, that is Abhijeet Kumar 7859, right? So yes, you can just revise this, guys, whatever we have like discussed. Yeah, again the things are not like at once you won't be able to remember, but once we like revise it again bar like multiple times, then it will be like easy for you. Okay, so no need to worry, right? All those labelings are there. Yeah, sure. Thank you. Tomorrow I'll let you know, guys, at what time I'll take class. Yeah, and we'll be revising each bone separately. I will be starting from the mandible, guys. I will be starting from the mandible, then maxilla, then yes, all the bones I will be discussing. No need to worry. Okay.